Today I'm going to go through a quick squat mobility tip, a little drill I like to use to try to work on the deep phase of the squat. So sitting down in the hole here in the squat. Now there are a lot of reasons why some people have a limitation in the squat. Sometimes it's the ankles here, sometimes it's the hips, but for whatever reason you're having a difficulty trying to get into this position, a lot of people notice that they have to kind of lean forward a little bit, or they have to kind of tilt their back a little bit, tilt their pelvis a little bit anteriorly to try to hold this position. Otherwise, they're going to fall back here. So whatever the limitation is leading to this difficulty sitting in this position, a lot of people have some tightness in the groin, and they go to stand up and they notice, man, I really feel tight here. It's kind of uncomfortable. And the hip flexors can tend to sort of get in the way of them improving their squat mobility. So if we want to be able to sit down here for, a lot of people say several minutes a day to work on this. It's really hard to do whenever you feel a lot of tension building in the groin area and it's really uncomfortable. So I'm going to teach you guys a trick today to try to get the hip flexors to kind of take a step back and relax a little bit so we can hang out here and work on our mobility, and the hip flexor tightness doesn't seem to be causing so much discomfort that we can't hang out here. So one of the things we have to appreciate is what the hip flexor's role is here. Like we said, if we're having a difficult time not falling back, well, the hip flexors are going to often engage to be able to keep you forward here so that you don't fall. And essentially what's happening is you're having this isometric contraction the whole time, and it just gets in the way. It's uncomfortable. So one of the ways I like to handle this is a little bit of a band drill. So I've taken a pretty thick power band here, and I've just closed it in a doorway. So you don't have to go to a gym to do this. You can do this in any house. And what I'm going to have you do is you're going to latch this band around your waist right at the top part of the pelvis here. So if you find your pelvis bone just at the very, very top, but sitting on that bone I find is the most comfortable spot. You're going to want to put a lot of tension on this band, because the whole purpose of this is that when you do squat down here into this position, and let's say you're working on ankles, you're doing some dorsiflexion, or maybe you're working on kind of rotating the hips externally, trying to open up that hip space, you can hang out here. So I'm completely putting all my weight on this band right now, which means I don't have to hold myself forward with my hip flexor muscles. So I can hang out here and I don't feel any tension developing. Now it's really important when you check this that you actually see, okay, can I put all my weight on this? Am I completely relaxed back into this and hanging out? If you're not, it's not a big deal, but what you'll notice is that every degree you have to kind of lean forward and tilt the pelvis to keep from falling back is usually going to get that contraction of the hip flexors. So here I'm completely hanging out, and I can do a lot of work in this position. I can lean forward and rotate, go over the ankles here, back and forth like that. I'm working on ankle mobility here. I can push my knees out and work on some outward hip rotation. I can play with my stance and go wider, go a little narrower, and I'm just hanging out here. So you might ask, what's the difference between this and just hanging on to a bar in front of you? Well, there's really nothing wrong with hanging out with a bar in front of you, but the disadvantage is you have to lean and flex forward in order to get that relaxed position, and this isn't really recreating our squat pattern very well. You're not going to reach forward and down when you squat with a bar on your back, not typically anyway. And so in this position, I can practice my upright position while I'm kind of hanging out. Another thing to appreciate is as you go upright, as I do that anterior pelvic tilt, I'm going to use my hip flexors to do that. So again, the advantage here is I can do that for a few seconds and I can take a break from it and still sit in this position. I can go upright and then I can take a break. Versus me just sitting here without any support, I don't have the mobility and I have to hang on the whole time. So I just don't get a break inside here in these hip flexors. And so I think a lot of people like this drill because it gives them an ability to hang out here a little while longer, a little bit more comfortable. And then a way to progress it would be, well, I can just scoot in a little bit and I can just get a little bit less support. So now I can't put all my weight on it without falling back, but it's giving me enough to where I could just a little bit less contraction and again, a little bit more comfortable. So if you're having difficulty during the squat drill, trying to work on your squat mobility, maybe you're trying to work on hip flexors, maybe you're working on ankle dorsiflexors, and this is kind of difficult for you because the hips lock up, try this drill out and see what you think. Thanks.